In today's video, I want to talk about something that affects so many of my patients, Irritable Bowel Syndrome or IBS. If you've been diagnosed with IBS, you might feel frustrated that traditional treatments aren't giving you the results you're looking for. I'll share with you why that might be happening and what you can do about it. So keep watching, because what you will learn today might completely change how you view your gut health. On this channel, I share insights that combine modern functional medicine with traditional healing wisdom to help you understand what's really happening in your body and support you on your path to vibrant health. Hi, I'm Dr. Shura Babayan. As a holistic and integrative medicine doctor, I help people who've been struggling with complex health issues find answers they haven't found elsewhere. Now let's get back to IBS. Before we dive into the differences between holistic and conventional approaches, let's talk about what IBS actually is. You know, it's interesting, in conventional medicine, IBS is often what we call a diagnosis of exclusion. What does it mean? Well, basically, when doctors can't find any other clear cause for your digestive symptoms, they often label it as IBS. Think about it. You're experiencing bloating, irregular bowel movements, maybe abdominal pain, and after running some basic tests and not finding anything obviously wrong, you get this diagnosis. But here's the thing. Saying you have IBS is kind of like saying you have a headache. It tells you what's happening, but it doesn't tell you why it's happening. Now, this is where things get really interesting. The main difference between conventional and holistic medicine isn't just in the treatment. It's in the entire way we view the human body. Let me explain. In conventional medicine, the approach is usually pretty straightforward. You have gut symptoms, so we treat the gut. Makes sense, right? The standard treatments usually include antispasmodic medications to reduce cramping, fiber supplements to regulate bowel movements, sometimes antidepressants because they found a connection between mood and gut function. Basic dietary advice like avoid trigger foods. But here's where holistic medicine, including traditional Chinese medicine and functional medicine that I'm practicing, looks at things differently. We believe that symptoms you are experiencing are often just the branches of a deeper problem, what we call the root cause. This is the same analogy as with the plants. If we noticed yellowing leaves, we don't treat leaves. We right away checking the roots of the plant. And this is crucial, that the root cause in case of pathology might not even be in your digestive system. In Chinese medicine, which has been treating digestive issues for thousands of years, we have this fascinating perspective. Imagine you have 10 people with headaches. In conventional medicine, they might all get similar treatments. But in Chinese medicine, we understand that these 10 people might have 10 completely different root causes for their headaches, and therefore need 10 different treatment approaches. The same applies to IBS. During my doctoral research, and yes, I actually did my dissertation on IBS because I find this topic so important and fascinating, I discovered something really interesting. In Chinese medicine, we often see a pattern in IBS presentation called liver overacting spleen. Now, don't worry if this sounds like a foreign language. I'll break it down for you. This is where modern science and ancient wisdom start to overlap in a really exciting way. When I was researching, I found numerous scientific studies showing that the liver function often becomes compromised before IBS symptoms develop. Most of the people will have different degrees of non-alcoholic fatty liver before they will find out that they have IBS. Isn't that amazing? This is exactly what Chinese medicine has been saying for thousands of years, that the problem starts in the liver. So this is usually what should be assessed and addressed first in some cases. Here's important to say that most people will have no idea if there is something going on with their liver, because their primary care physician will look at their labs and will say that everything is normal. But normal is not what we are looking for or what we want to have. We want to have optimal health. So that's why doctors usually will miss some key dysfunctions. I can make a separate video on that. Let me know in the comments if you are interested in that, and if you want to understand why being normal is actually not normal. Now, as we talked about liver, I know that some of you might be thinking, oh, great, I'll do a liver detox. But please, please wait, because this is exactly where working with a qualified practitioner becomes crucial. You see, before you start to do any kind of detox, we need to make sure that your detox pathways are functioning properly. Your body is ready to handle the detox process. You are supporting all the necessary systems. I see a lot of people jumping into trendy detox programs without a proper preparation and not knowing what exactly is going on with their body. And this can sometimes make things worse, not better. In my practice, I combine knowledge from both Chinese medicine and functional medicine. This gives me a unique advantage. I can look at your symptoms through multiple lenses. Here are some of the most common root causes I see in IBS presentation. Hidden infections that conventional testing might miss, imbalances in gut bacteria, poor bile flow, or dysbiosis in bile ducts. And yes, that's actually a thing. Food sensitivities that aren't obvious, liver function issues, stress affecting your digestive system, low stomach acid, blood sugar dysregulation, hormonal imbalances, and this list can goes on and on. Let me share something from my clinical experience. In my practice, I often see patients who've tried everything conventional medicine has to offer. They've taken all the prescribed medications, followed all the standard advice, but still struggle. We start looking upstream, and yes, it's important to look upstream, not downstream, investigating these root causes I mentioned above. That's when we often find the real answers. This is really just scratching the surface of how holistic medicine approaches IBS differently. If you're interested in learning more about specific root causes, let me know in the comments below. I'm happy to make more detailed videos about each one. If you're struggling with IBS and want to understand what's really going on in your body, I invite you to book a strategy call with me. The link is in the description below. During this call, we can discuss your specific situation and create a personalized plan to address your root causes, not just manage symptoms. And remember to subscribe to my channel and hit the notification bell if you want to learn more about holistic approaches to gut health. I'd love to hear about your experiences with IBS treatment in the comments below. And if you're interested in learning more about Chinese medicine and Chinese medicine patterns that I talked earlier, or any other aspect of holistic gut health, let me know in the comments as well. Your questions, will help me create content that's most valuable for you. Until then, see you in the next video. Bye, and stay healthy.